Hello everyone, welcome back to Medico Education. In today's video, we are discuss about external features of heart. So, the human heart has four chambers. These are the right and left atria and the right and left ventricle. Now, our today's topic is heart groups, apex and base, borders, surface of the heart. So, heart has apex, base, three surfaces, four borders. Let's start. Heart's groups. The heart group also known as sulci. So, heart groups or it's also known as sulci. So, there are three groups. First one is atrioventricular or coronary sulcus. Atrioventricular group's other name is coronary sulcus. Interatrial group and interventricular group. Atrioventricular or coronary sulcus. The atria are separated from the ventricle by a circular atrioventricular or coronary sulcus, which is divided into anterior and posterior part. Anterior part divided into right halves and left halves. Anterior part consists of right and left halves. Right half is oblique between right auricle and right ventricle, lodging right coronary artery. And left half, left part is small between left auricle and left ventricle, lodges circumflex branch, left coronary artery. So, right half, right coronary artery, and left half lodges circumflex branch of left coronary artery. Posterior, below left atrium, it contains coronary sinus. Interatrial group. The interatrial group is faintly visible posteriorly, while anteriorly it is hidden by the aorta and pulmonary trunk. Anterior part it is hidden by the aorta and pulmonary trunk, and posterior faintly visible. Interventricular group. So, interventricular group, there are two parts, anterior and posterior. The anterior interventricular group is nearer to the left margin of the heart. It runs downward and to the left. And interventricular group posterior. Posterior interventricular group is situated on the diaphragm or inferior surface of the heart and nearer to the right margin of this surface. So, this is a diagram where we showing there are many parts of the heart. This is arch of aorta, SVC and IVC. Pulmonary trunk is divided into left pulmonary artery and right pulmonary artery. And these four are, it is left pulmonary vein 2 and there are other two right pulmonary veins. It is LA. This is left ventricle. It is right atrium and this is left atrium. And this group is known as coronary sulcus. Coronary sulcus or atrioventricular groups. Atrio, it's present between atrium and ventricles. Atrioventricular groups or coronary sulcus. And this is posterior interventricular group. Posterior interventricular group. Apex of the heart is formed by the LV, left ventricle. It is directed downwards forwards and to the left and is overlapped by the anterior border of the left lung. It is situated in the left fifth intercostal space, 9 cm lateral to the mid-sternal line, just medial to the mid-clavicular line. In children below 2 years, it present in fourth intercostal space. What is dextrocardia? Apex is on the right side, where apex present right side. Normally apex is on the left side, and in dextrocardia apex is on the right side, and it is a part of a condition called situs inversus. If we look at the shape of a pyramid, the bottom portion is called base and the top is called apex. So base is also known as posterior surface, left atrium and small part of right atrium. Borders of the heart. Upper border. The upper border is slightly oblique and is formed by the two atria, mainly the left atrium. Right border is more or less vertical and is formed by the right atrium, and it extends from superior vena cava to inferior vena cava. Inferior border. Inferior border is nearly horizontal and is formed mainly by the right ventricle. A small part of it, near to the apex, is formed by the left ventricle. It extends from IVC to inferior vena cava to apex. Left border. Left border is oblique and curved. It is formed mainly by the left ventricle and extend from the apex to left auricle. Surfaces of the heart. There are three main surfaces. First one is anterior or sternocostal surface. Second one is inferior and diaphragmatic surface, and last one is left surface. Anterior or intercostal surface, mainly by the right atrium and right ventricle, partly by the left ventricle and left auricle. Inferior and diaphragmatic surface rest on the central tendon of diaphragm, 2/3 by the left ventricle and 1/3 by the right ventricle. Left surface mostly by the left ventricle, upper end by the left auricle. What is crux? Crux is meeting point of interatrial, atrioventricular and posterior interventricular groups. So it is a meeting point of interatrial, atrioventricular and posterior interventricular groups. So here is a diagram. This is base and this is anterior surface. It is left pulmonary surface, and this line obtuse margin, it is right pulmonary surface and inferiorly diaphragmatic surface, and this line inferior or aqueous margin. So other surfaces of the heart. Anterior surface mainly formed by right ventricle and slightly left ventricle. Right pulmonary surface, this is right pulmonary surface, mainly formed by right atrium. Inferior surface, mainly left ventricle, here is left ventricle and slightly right ventricle. Inferior surface. Base or posterior surface, mainly left atrium and slightly right atrium. So base mainly formed by left atrium and slightly right atrium. Left pulmonary surface or also lateral surface, mainly LV, left ventricle formed by and slightly left atrium. So there are two diagrams. First one anterior view and second one inferior view of the heart. Anterior view, this is right atrium and its right pulmonary surface. Right atrium and this green circle, it is right pulmonary surface. It is left auricle. This one right ventricle and this one left ventricle. This violet circle, it is anterior surface. It is right pulmonary surface of the heart and it is anterior surface of the heart. Now inferior surface, it is LA left atrium, RA right atrium. This green circle is base and this is left pulmonary surface. It is right pulmonary surface anteriorly and inferiorly left pulmonary surface. It is left ventricle and it is right ventricle, and this red circle inferior surface of the heart. So thank you for watching these videos. I hope it is helpful for you. So please subscribe, like and share.